Alors, mesdames, messieurs,
So, ladies and gentlemen, dear colleagues, welcome to this press conference to go over the situation in Quebec about COVID-19. The Premier of Quebec, Mr. François Legault, is today with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier, thank you very much, and hello, everyone. The mask that I'm wearing today was made by the Atelier Création du Suroît, an organization of social economy from Valleyfield that cares for young women from 14 to 24 years of age who experience difficulties. And from that writing, the minister said that in December last, their locals where they worked were destroyed by fire, but everybody got together and they're reopening next week. So bravo, they help young women who face different difficulties. Today we are getting to a new stage, which is very important, 5,000 deaths. Of course, I offer my condolences to all families of those 5,000 victims. This is a lot of people, a lot of Quebecers. 90% of them lived in residences for long-term care, whether they be CHSLDs or PAs or RIs. Of course, as a premier, this is something that affects me. And I've said it before, and I repeat it. I feel the duty to make sure that the situation be finally fixed. This situation is a problem that we were aware of, had been aware of for a long time in our CHSLDs. Unfortunately, we did not act quickly enough. The different governments, one after the other. The main problem, a scarcity of staff, about 10,000 employees missing before even the start of the crisis. As you know, next Monday, the 15th of June, 10,000 people are going to be starting a 3-month training program to become CHSLD orderlies. So, of course, adding 10,000 people, 10,000 employees in CHSLDs is something that is going to improve the quality of the services that are given to residents, but also, and it is important to say so, those people are going to be trained amongst other things in the prevention of infections. And I think that we have to be prudent. I hear all sorts of conclusions. Yes, at the beginning of the crisis, particularly at the beginning of the crisis, there were visitors who infected some residents in those establishments. There's also staff that infected residents. It spread from one resident to another. But let's remember that at the beginning, there was no certainty that people who had no symptoms could be carriers and transmitters of the virus. So I think that we have to be very prudent before blaming anyone. I think that the people who were there did everything they could. However, as a society, we must learn lessons from this. So, more staff, more trained staff, trained in infection prevention. And we absolutely need to renovate our CHSLDs. Just last Friday, I met with the president of the Eastern Township CIUS, who said we still have CHSLDs that have 2, 3, even 4 people per room. That makes no sense. Just in terms of prevention of infections, we have to renovate our CHSLDs. We have to build the new CHSLDs that we're going to be calling the homes for the elderly, with single occupancy room that will be bigger, more space as well if ever there's a second wave, or if there were such a problem in the coming years, making sure that we can correctly separate hot zones from cold zones. So we have to draw lessons from this. Of course, I won't lie to you by saying that it's going to cost a great deal more. If we just have 10,000 more employees, if you can make a calculation at $49,000 per year, that's $500 million. Yes, and on top we have to add the social benefits. There's going to be savings, of course, on overtime, but there will also be an impact on private residences. We've committed ourselves to helping them, and that is recurring amounts. Of course, renovating and building new homes for the elderly, those are billions of dollars. But honestly, I think that Quebecers will agree with me to say our elderly deserve this. And it's also a question of pride. I think that it's one thing that we all wish for in Quebec, to do whatever is necessary so that in the future we can be proud of the way that we treat our elderly who live in long-term care facilities. Now, if we look at the present situation, of course, we continue having a lot of deaths. There are still over 1,000 people infected in residences. It's a lot less than what we had. At one point, we had almost 5,000 people infected. But it remains that there is a trend in the hospitalizations, which is clearly downward. Yesterday, we had 971 people who were hospitalized. In the past week, it's a lowering of 208 people. If you recall, we went up to 1,800 thereabouts in hospitalization rate. So we're now at half of the peak that we had. But this does not mean that the virus has disappeared. It's there. It's lurking. It's prowling among us. Yes, we must reopen our economy, our activities, get back to a more normal life, but we have to be prudent. We have to relaunch the economy without relaunching the pandemic. That means that we need the collaboration of Quebecers. The guidelines are clear. Wash your hands. Keep 2 meters away from other people. Wear a mask if you're in a place where there's a lot of people. Of course, in the coming weeks and months, we are going to be concentrating on economic recovery. I've already said Pierre Fitzgibbon was given a special fund of $2.6 billion at Investissement Québec in order to help businesses. We have all sorts of measures, for example, helping them with rents. But it is important that as many businesses as possible reopen their doors so that we can start seeing the unemployment rate go down. The unemployment rate, which according to the latest statistic was at 13.7%, so there's still a lot of people not working. Of course, I also wish to talk to you about our infrastructure program. I think that all economists will say so. When the private sector isn't there, it's up to the public sector, the government, to do more. To do more, we need to accelerate the infrastructure projects, and this is not a waste of money. First, there's the CHSLDs and the homes for the elderly. There are hospitals. I come from Sainte-Anne-de-Bellevue and the Vaudreuil Hospital. I've been hearing about it my entire life, it would seem. Friday, I was in Sherbrooke in the Fleurimont Hospital, where they want to add a mother-child center. Has been expected for at least 15 years, so it's not going to be luxury to invest that money in infrastructure projects. That is why we have tabled Bill 61. And I want to get back to that. Of course, the opposition is concerned. Certain journalists as well, mainly on two aspects. The first one, the evaluations, the environmental evaluations. I just want to let you know that in Quebec, those can take up to 11 months. The idea is not to reduce the requirements. The idea is to reduce the delays, to save on some of those months. And I cannot believe that we cannot, together with the opposition, the three opposition parties, to give ourselves the parameters so that it requires fewer months while respecting the environmental requirements. The second comment or the second concern that I've heard about, and I understand this, we lived the Charbonneau Commission, all the corruption present in the construction environment. Nobody wants to go back to that, so we want to make sure that the contracts are given in the correct way. But there is a possibility at some point of accelerating things, all the steps. I'm thinking about the expropriations. I'm thinking about the different rights. It can take up to 18 months, to design the environment, the built environment. And I think that while giving contracts and while making sure that there is competition, there is nobody, I think, in Quebec that wants to re-experience contracts being given to one's friends. So I can't believe that with the three opposition parties, we can't give ourselves parameters so that things can go more quickly without falling into corruption and collusion and all the problems that we saw at the Charbonneau Commission. Now, it's urgent to act, and I hear the opposition party say, listen, this was tabled really late. Well, please remember that not too long ago, we had to concentrate on the health part of the pandemic, and now we're concentrating on the economy side, but it's urgent that we act. It's urgent, first, that we renovate our CHSLDs, our homes for the elderly, that we send people back to work, people from the construction sector that have less work on the private front. And today I want to launch a message to all three opposition parties. I believe that Quebecers want for us to work together. And it's urgent to act. So I know that the session was supposed to end on Friday. What I wish to say to all three opposition parties is that if it's necessary to prolong it in order to be able to adopt this bill, and to send Quebecers back to work quickly, we're ready to do so. I think that we all have a duty for the well-being of Quebecers, of making sure that we accelerate these infrastructure projects while giving ourselves the necessary parameters to make sure that there is no corruption, so that environmental evaluations be done, even if they are done more quickly. I'm certain that we can do environmental evaluations in less than 11 months. So I would invite all three opposition parties to work in good faith. I'm convinced that we can agree for the well-being of Quebecers. Thank you.
With today's number, Quebec has now more than 5,000 deaths linked to the coronavirus. I want to offer my sympathies to the families of these victims. As a government, this tells us that we must do better in the future. That being said, we continue to see an encouraging pattern in the numbers, but that doesn't mean the virus is gone. Even if we gradually reopen our economy, we must stay vigilant. We have two challenges in front of us: to restart our economy and to do so without restarting the pandemic. To stop the pandemic, we must prepare and continue to respect public health instruction. And to restart our economy, among other things, we're counting on our infrastructure projects. With Bill 61, we aim to accelerate these projects, such as hospitals, senior homes, public transport, but we want to adopt the bill with the collaboration of opposition groups. It was never our intent, I said it at the right beginning, to force the adoption. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will now be starting with the French question period.
Monsieur le Premier ministre, Madame McCann, Dr. Arruda, une question en deux temps. Monsieur Legault, les oppositions...
Mr. Legault, the opposition members, you have used this press conference to put your entire weight to have Bill 61 adopted. What the oppositions are saying is that you don't need the bill to be able to spend and to launch projects. Are you ready to remove the bill? Dr. Arruda, do you need 2 years to maintain the law on public health? First, the question of the 2 years is not in the law. There is no limit date, and we're ready to negotiate if we want that on what we call the health emergency. So we can talk about the deadline. Now, I've heard certain critics from the opposition say we don't need Bill 61. Honestly, when we look, of course it might be true for a school. Maybe we can get there in a few months. But when we start building something that's a little bit bigger, if it's a road or a hospital, there's the expropriation process, which can take up to 18 months. And then there's the environmental authorization process, which can take up to 11 months. And then there are all the authorizations for the urban planning at another 2 to 3 months. And I'm skipping over other sectors, fauna, depending. So if we wish to, summer doesn't last very long in Quebec, so we are entering now in the construction season. If we want to be able to have the entire construction season busy, as well as the summer 2021, we need this bill. And I will repeat what I said earlier. We are ready to do accommodations. We are ready to reassure the opposition that even if we don't take 11 months to do the environmental studies, that we'll still be respecting the requirements. We'll still be making sure that there will not be any corruption or collusion, that the contracts, in the way that the contracts are given, that there will be a competition, even if we accelerate the delays to be able to send back to work people as quickly as possible. Now the numbers in the last 88 days, what you did the best and what you did the worst. Oh, listen, I'm going to let you decide that, what was done well, what was done badly. I'm not going to talk about report cards. No, I'm not talking about, a report, what you would have changed or what you were happy that you did. Listen, all governments, including mine, we should have increased the wages and employees in CHSLDs.
Prochaine question, Marco Belair-Cirino, Le Devoir.
Bonjour, Monsieur le Premier ministre. Concernant la lutte contre...
Concerning the fight against racism, you said yesterday that Quebec is due for a tranquil evolution. A lot of people found your expression weak, following that of active revolution. Concretely, what can we expect from your government before the next general elections in 2022 to have racism take a few steps back in Quebec? I would like for you to give me a few days. I would like to meet with certain people before I make an announcement, but what I want is result. I'm a pragmatic person. I don't just do speeches. I want us to find a means of reducing, ideally to have racism completely disappear in Quebec in all domains, including in the police corps. So I'm consulting a few people, and I should be able to, in the next few days, to announce the parameters and mandates of what we are going to be giving ourselves in order to act. I want us to act. Last week, you were asked how to explain the underrepresentation of racialized people, no diversity, for example, in the public sector. You said that most positions were in Quebec and there are fewer racialized people in the Quebec City area. But the Commission of the Rights of People and the Rights of Youth made a report showing that, for example, in the SAQ branches of Quebec, there's only 122 visible minorities out of 7,500 employees. That's 1.6%. There's also, for example, in Hydro-Quebec, only 706 people of color out of over 19,000 employees. How do you react to these numbers? First, to tell you that it's been a year and a half that we've been in the government, so we haven't hired many people. So these are people that were hired throughout the years. But I do recognize that there is a problem. There's a problem. Whether it be in the ministries or in corporate enterprises, there's an underrepresentation of visible minorities and members of the different communities. So we have to make efforts, and it has to be part of the mandate, and we have to give ourselves concrete objectives in future hirings. It's a real problem, and it's a problem that's been around for a long time, and we have to act. I would like to keep going with the same subject, if you will, because upon reading this report on the rights of people that talks about systemic discrimination in the public organization, we can ask ourselves the questions. How many reports are we going to need? It's been 20 years that the application on the Job Equality Act has been talking about it. What are your objectives? Well, if you know me a little bit, you will know that I'm not somebody who likes reports and forums and committees and all that. Sometimes it has to be done. We have to give ourselves the orientations before acting. But what I want is that by the end of my mandate, that there be actions and changes that will be brought. So I'm asking you for a bit more patience, and we will be announcing things. We have to consult, but I think that we're now at the stage of acting. On Bill 61, you evoked the environmental requirements, saying, can we do that in less than 11 months? That is taking less time to fill these requirements. I bring that back to my domain. If I have 2 hours to write an article versus 2 weeks, at the end, I'm not going to have the same quality. I'm not going to have such a fine analysis in the article and what I publish. How is it possible to keep the same quality of environmental evaluation if we give less time to the people doing it? I think it's just a question of common sense. I think that evaluating the environmental impacts of a project is not something that requires necessarily 11 months. I think that the work can very well be done much more quickly. So there is a process as well that is not simple. The maximum delay goes, is there a way of asking, for example, all the questions at the beginning? And to do that in the same step rather than having different stages. So I think it's possible to do good work in a shorter period. On the same subject, there are groups that have been testifying in parliamentary commissions, including environmental groups this morning, that showed that the problem was not necessarily the environmental standards, but the resources that are allocated to the Ministry for the environment to be able to proceed to the inspections. The number of inspectors, they talk that there have been compressions these past few years. In that context, why need Bill 61 and articles on the environment? Wouldn't it just be better to simply add resources for more files to be able to be managed more quickly? I think that we can do the two. We've started adding resources already. And if it's necessary to add more, we will. But there is a process and minimum delays that can be reduced or could be. Concerning the problems concerning racism, you're evoking a plan or a solution in the next few days, but we can see that it's a transversal problem. It has to do with housing, it has to do with public safety, it has to do with labor and the public service, so the Treasury Board. How to make sure that there's a consultation in all the actions, because, it can't be given to one minister rather than another, since it's a very broad issue. So isn't that part of the problem? Well, yes, in fact, the group that will be responsible will have to make sure to see the impacts in all ministries. It's not just one ministry that this concerns. There are many. And in our society as well. There are many places where we have to act. So the group will, in fact, be a transversal group.
Bonjour, messieurs, madame. Il y a des tenanciers de bar qui menacent.
There are bar owners who are threatening to disobey. If that is the case, are you going to be sending people to give them fines or sending inspectors of the CNESST? Well, laws have to be respected. We said that we wanted to deconfine gradually. So what we're saying is that we reopen restaurants gradually and then bars, but for the good of all of Quebec society. The last thing that we want is to have an increase of the spread of the virus because we're opening everything at the same time. So we're going to have the law respected, and what has to be closed will have to remain closed. Concerning physical distancing, Mr. Arruda, here it's 2 meters in Quebec. Elsewhere in the world, it's often 1 meter. The World Health Organization recommends 1 meter. You let it be known last week, that for announcement of sports, it might become 1 meter. Why are we different from the rest of the world, and when is it going to be 1 meter here? What has to be understood is that everything is analyzed with a thought to potential risks. What we know is that at 2 meters, the risk is relatively low. It doesn't mean that it's not possible. Many things can happen in life. At 0.5 meters is a gain, even more than, 1 meter. So that's why we chose to go with 2 meters, because you understand that when we say 2 meters, people are going to, go around 1.5 meters sometimes, or even 1 in a few opportunities. So it was a question of prudence. But now, with activities starting again in society, with the feasibility of certain things, and with certain clients that are not as risk, younger people, it's possible that we will evolve, looking at international experiences, the decisions that were taken. It's like blood pressure. When we say 140 out of 70, we can go down 120 over 80. It's a curve, often, in terms of protection. And I would tell you that we're acting with prudence, knowing very well that when we say 2 meters, and now I'm thinking, I don't want to tell people to go to 1 meter or 1.5 meters because it can be interpreted differently. But if we say 2 meters, we were going to have better protection. It's a new virus. We don't know how it behaves, even in schools. We wanted that because we were scared that, children were going to have big outbreaks and transmit it to their parents and grandparents. Now we're evaluating the risk. Right now, we say 2 meters as far as certain activities are concerned. Now, for sports and things, there are parameters being made. Contacts that are quick are not as high risk, especially outside, and all of that is being done. All of that is being evaluated. And we're trying to have a look at the evidence and clearly 2 meters is better than 1.5, and 1.5 is better than 1 meter, and the risk plummets after 2 meters, however, in a very significant way. Mr. Premier, yesterday there were consultations on Bill 61. Representatives from the construction environment expressed themselves and said that you were not going to be going back to corruption and collusion. Did that reassure you about the new practices in the construction environment? Whose words? The people who expressed themselves yesterday. They said vaguely that, the Charbonneau Commission was all behind them and the industry had improved since then. Well, listen, let's not forget that in our team we have Sonia Lebel. And we have Christian Dubé, who's a chartered accountant. We have a few chartered accountants in our team. Myself, honestly, I'm not worried with the corruption aspect. There's many people who actually started working at the CAQ because they were tired of corruption in other parties. So, of course, we are going to be setting up the necessary measures in order for there not to be corruption. You said earlier on that Quebecers are sending out the message that they wish for parties to work together so that the bill be adopted and so that the projects can go forward. This is a message that is probably also, addressed to your party and yourself. You talked about accommodations. What would you be ready to take a step towards the opposition and have the bill adopted? Well, to set up parameters. It's a little bit up to them to tell us. If we say that there is no question of requiring the requirements, what we want to reduce are the delays. Well, with that in mind, we should be able to work together. We gave a list of 200 projects. Are they wanting to add some to that or remove any? these, in my opinion, are projects that have a consensus in Quebec. Certain roads, certain hospitals, certain schools. If they have a hard time with some of the projects because they believe, for example, that such and such a project could have a very negative impact on the environment, well, maybe we can review the list of projects, but I would like to better understand what their concerns are. What would you answer to Guy Bertrand and the foundation that he supports, the people who are accused of destroying Quebec because of the health measures and that want to remove certain aspects of the emergency law, and they want to create a lawsuit? Well, I think that the measures that we took were necessary. They look like the measures that were taken pretty much everywhere in the world. We had a virus that spread at very high speed. We had to make sure that we could confine as many people as possible in order to stop this spread. We did it in the name of the superior interest of Quebecers and of Quebec. That some might believe that we did it or continue to do so uselessly, well, we listen to science. Those people might have a different kind of science. What can be done? If you allow, Mr. Premier, when we predict things, we don't, when we prevent things from happening, we don't see it. We had a major problem in Quebec with our CHSLDs, way too many deaths. But had we not taken the other measures, there would have been more cases in the population. I mean, history will say, the epidemiological studies that will come will say it as well. But I think that we had a health system that was able to, survive because we didn't have to make any dramatic choices between such and such a person and intensive care. So we'll see what history teaches us. But I believe that we acted with celerity, and there were factors, important spread in the eastern part of the United States that made it that there were travelers. We had the March break or the spring break. All of these are effects that bombarded Quebec with the virus. And the virus is still there, and I want to tell you that is why we're going slowly in terms of deconfinement. There are certain places where, we realize that it's reappearing a little bit, thank goodness not at the same rhythm, but we have to keep a very close eye on things. I think that we acted as the public health authorities the world over recommended. Mr. Legault, with Bill 61, it's the economic recovery and the committee that was set up for the economic recovery, and that was set up a few weeks ago. Wouldn't it have been better to put the Minister for the Environment directly in that committee right from the beginning? That way there might not be any questions on the environmental requirements now. Well, first on the Committee for the Economy, the Minister for the Environment is consulted, the Minister of Agriculture, of Tourism, all those people are consulted. So all the different ministries are consulted. But one thing that is for sure is that the mandate of the committee is to create as many jobs as possible, as quickly as possible. So the environmental standards have to be respected. And many projects are public transportation projects as well. Everyone is aware that for me it's important to have those projects go forward, including the tramway. So I think that the parameters are there, and there's quite a bit of work that is being done. For example, right now we are looking at everything having to do with the hotel sector. Well, that concerns more the economy than the environment. How can we relaunch the hotels? Which hotels are we going to help? The big ones, the little ones, the Montreal ones, the regional ones? So, I think that the Minister for the Environment is working very hard on other files. I would like to come back to the 1 meter question, Dr. Arruda. At what moment would you be able to perhaps say whether yes or not, or no, you will be recommended the 1 meter distance using what already exists in terms of data? Because you'll understand that it's going to ease a lot of things, for example, gatherings. Inside gatherings, for example, that were announced yesterday, restaurants as well. So when could you at least give some kind of indication? I will tell you, I'm not going to tell you the day, but I would say that within a few weeks, we'll be able to have a look at that. We also have to see how things will evolve with the 2 meters. You understand? We have to go prudently. We'll see whether we're not going to be generating outbreaks with 2 meters. If we don't, that's pertinent information because, we can look at what is being reported outside in terms of recommendations, but between recommendations and what is applied, there's very often, a difference. So if there's no outbreak associated with a 2 meter distance, and then we can lower it. But if we realize that we still have outbreaks, because beyond distancing, there's the question, the entire question of handling of food, for example, thinking here about restaurants, so we'll see. But according to what we know as well, people inside homes, probably the 2 meter, we want it to be respected between the families, but we know very often that the 2 meters gets a little smaller sometimes. We had to be rigorous at the beginning and see what kind of reaction we encounter and then keep going forward. And I wish to mention the effort of all the people who are adapting their practices, restaurants and all that. I wish to thank them for following the guidelines. I know it's not easy for people. We have a very strong trend to want to go back with what is normal, but we have to go prudently. And with what is going on here, when we open, we say that it's about between 10 and 14 days after to see the effects, then we'll be able to see what will happen. Many voices are rising today. It's the bar owner or the gym, private gym owners who are in front of the National Assembly. There are driving schools as well. Are you able to more specifically give to those who say that they have been forgotten, to give them, a kind of schedule? Because right now they say that they're in no man's land. I think that this is an exercise that we're doing because the great sectors, the big sectors is one thing, and then, as we say, the devil is in the details. Such and such a subgroup and such another. So we're looking at it. We're going to announce it as much as possible so that people can see the perspective. It's not that we made deliberate choices of forgetting anybody. But as we were saying, it's always within that logic of saying, we're deconfining, we see how things react, and then we continue. But I think that within, I won't say days, I'm going to say weeks, we'll be able to have a more specific plan for the activity sector by being aware, for example, that the further we go, the more we're certain that the deconfinement will have been going well and we'll be able to open up things a little bit more. Our fear right now is that even if things are going well, is that we start going back up and that we have to reconfine groups. But I understand those people. I am myself, every time that I move around and I want to go someplace and I see that it's closed, like, oh my God, who closed that? Because we forget. No, I'm serious. I'm telling you very, very seriously. Sometimes I want to go grocery stores and it's closed that day. Sometimes I want to go to the restaurant. Oh, it's true, restaurants are closed. And we realize, it's difficult. And we're not doing it for fun, but we have to keep that prudence.
Je n'aurai pas le temps de refaire un tour complet, mais je peux prendre quelques questions additionnelles.
A few additional questions.
Alain Laforêt, TVA.
On en a parlé il y a plusieurs semaines.
We talked about it weeks ago. Mr. Legault, we had both agreed that in 1918 we weren't born, and we're waiting for that second wave. We talked about it with Dr. Arruda, who said that I was criticized because I bought too much medication for H1N1. What are the measures that have been taken for the second wave as far as the protective equipment is concerned? Are there any reserves being made right now? How is that working? For the equipment, I think that if it arrives this fall, we'll be pretty independent in Quebec. I know that the federal government, on top of that, is creating a reserve, but in the four most important items, the masks, the N95 and surgical, the gloves, and the gowns, that we be able to have enough. So a good part of it is going to be made in Quebec. Dr. Arruda, the Alberta government has concluded an agreement with fast food like A&W to distribute masks. So people can order masks when they order food, for example, in a drive-by. Is it is that what the public health will do, to distribute masks everywhere? Right now, we want to make sure that people have access of the face coverings. I don't know what kind of masks it is that you're talking about. Surgical mask? Okay. Well, let's say that for us right now, our intention, that's not what our intention. I'm not saying that, it won't happen. Everything can be looked at and done. But we do want to preserve medical masks for the medical sector. However, we do want to make others accessible, and I think that many companies can make very high-quality face coverings that do have an impact in community life, and that is what we are going to be favoring. But as I was saying right now, there's no question of making it mandatory. The question has kept coming back. But if ever we did, we would make sure that people who don't have the means, for all sorts of reasons, to have access to them. There were masks that were offered, money that were offered in Montreal, etc. before. So we are evaluating the situation. And I would take advantage to encourage Quebecers who are circulating even outside of the MMC, please wear a mask when you move around. Wear face coverings, rather, I should say. Wear it when you're less than 2 meters away. This is a practice that we have to try to maintain. My colleague was talking about preparations being done for the second wave. Dr. Arruda, right now, with the advancement of scientific knowledge that we have, are you preparing us for a second wave for sure this fall? Listen, I would love to say no, and I would love to say that in 2 months everything will be over. That would make me so happy. What we can see right now is a lowering that is significant. The first wave for me is not quite over because we've just started deconfining, and I would like to see and make sure that it continues going down and that it will stay low. But in these respiratory viruses, very often there's an aspect of seasonality. So this decrease is associated to the fact that it went over Quebec, and maybe the season is making it that it's going down, but not considering that we may have a second wave would be dangerous, because if ever it hits us and we're not ready, that is why we've started looking at the numbers. We're still in the zone of fragility. We want to improve every area, whether it be in surveillance, declaration of deaths, making sure that we have the people to do the interventions. We have computerized many of the processes in case management, contact tracing. We want to have material to be able to do screening. We want to be able to, train teams for the different places. So that is clear that we are looking at where there was fragility, the training, the 10,000 workers. That is one of the major factors. That we had a scarcity of staff. That is what makes it that we had a horrible situation, and we had to prepare ourselves for a second wave. And a second wave can be even more complicated because it will also come, unfortunately, with the season of the other respiratory viruses, including the flu. So it is the priority of the network right now to prepare ourselves for the second wave. And yes, we have to prepare ourselves for vaccination against the flu. So that is our priority this summer. And we have an entire operation in CHSLDs in terms of the residences, the hospitals. We're going back to regular activities to be able to give access to people that, whose operations we suspended. So we're doing them right now in an accelerated rhythm. And that preparation will last throughout the summer. The staff, the equipment, the training. And we're paying particular attention to Montreal and the Greater Montreal area. We want to understand what happened in Montreal in terms of the coordination of activities, and today we named a deputy minister who is going to be coming to Montreal and who is going to be working with the different establishments together with public health in order to really pose a good diagnosis and to see that things be improved for the second wave. So that is the main focus of the network. Last question in French. Mr. Legault, the decision will be taking this week for going back to school in September. The scenarios will be made public this week so that schools can prepare themselves. But the situation could very well change on one side or another. It could improve, it could deteriorate. The decision that will be made this week, is it a final decision, or will you be readjusting things for the back to school in September? Well, there's always a possibility of readjusting things. We deconfine gradually. We look at the impacts. We follow. We don't hope so, but there might be a second wave. What we would wish is that all students go back to school on September the 1st, but at the same time, we will be following the situation very closely in the next few weeks.
Merci. So time now for questions
English.
in English. We'll start today with Cathy Sonnet, CBC News.
When you said, Premier Legault, that you wanted to see a quiet evolution on racism in Quebec, I guess it's definitely more a slogan for you. Please define what kind of tangible change you want to include, what kind of results you want to see before the end of your first mandate.
Okay. First, I want to see results before the end of the mandate. So in the next few days, we'll announce the mandate we'll give to a group, and I want to see results. And it will touch many sectors. So it's too soon at this point to give you more details, but I want results.
Talking about Bill 61, some opposition groups will qualify Bill 61 as a bulldozer. You mentioned the environmental authorizations. Denis Galland was talking about the Article 50 about public contracts this weekend, saying that that would give a blank check to the government. So what do you say about this criticism, like this huge criticism, and how willing are you to give more time to this parliamentary session to extend it, to make sure that every political party is on board on this?
Okay, first, I'm hoping to extend the session in order to have an agreement, because like I said since the beginning, I won't adopt the Bill 61 unless we have an approval from the three parties, the three other parties. Now, regarding the two subjects where some people worry, environmental assessment, what we want is, in Quebec, for certain project, it can be up to 11 months to have an environmental assessment. We think that without decreasing the requirements, we can do that faster. But we have to reassure the opposition parties that it will be done correctly, even if it's done faster. Regarding the corruption, first, our president of the Treasury Board, Christian Dubé, he's a very straight guy. I'm not the one saying it's you, but I do agree with you. And we have Sonia Lebel, who was on the Charbonneau Commission, that is checking everything to make sure that never in Quebec we go back to collusion, corruption, and giving contracts. So, again, I'm willing to give some, maybe put additional words in the Bill 61 that will be requested by the opposition parties in order to reassure everybody. But it's clear that nobody wants that. We want to have competition and give contracts at the lowest cost possible.
Thank you. Samuel Pouliot, CTV News.
Hi, yes. There was a protest this morning in front of the Parliament asking for gyms to reopen. When do you expect to reopen gyms, and why hasn't the date been set yet?
It's going to be open, I would say, in the next weeks. We are finishing the different plans, and we'll announce those things. I understand that you understand when you are in a gym, you are touching a lot of things, and the risk of contamination could be higher. But we are working on protocols to help gyms to open in a safely manner.
Okay, and about physical distancing, until now it has been 2 meters. Will we get to a point where it will be less, like 1 meter?
It could be. As I was telling, we know that 2 meters, the risk is very low. 1.5, the risk is there, but is also lower than 1 meter. So it's why people have used different levels based on the risk evaluation they want to make. We decided to go with 2. At the beginning, it was 1 meter. Then we had some data that makes it 1 was not enough, so we went to 2. And because we were with an unknown virus, we want to be more cautious, knowing that when I'm telling 2 people are doing 1.5 and 1 meter. In fact, the 2 meters is a difficult distance. If I say 1, the people will be at 15 inches, or it's why we did it. We're going to evaluate that. We're going to evaluate also what happens with low-risk people, which is young people who are not. So it's why probably things are going to change for schools, and I would say also for garderies, daycare centers, probably. We will still be, I would say, very protective with our elderly people, because they are at higher risk, and especially for the ones who have chronic disease.
Next question, Philotier, Montreal Gazette.
Hello, good day. A little question for Minister McCann on what you just mentioned about the sous-ministre, the new deputy minister. Can you elaborate on what role, because we did see during the first wave that there was a coordination problem with all the various agencies in Montreal. Mr. Legault has spoken about that. What role does this person have in managing?
Well, she's a sous-ministre, a deputy minister, and she will have to make a diagnosis to really working with the public health in Montreal and the different organizations to make that diagnosis very quickly, but properly, and also make recommendations to improve in the best delays possible, so that we're ready for the second wave. So we want this work to be done this summer, and we want to implement quickly those recommendations. This is a problem we realize that created difficulties for a lot of people in Montreal. Has to do with the dépistage, with different areas in the public health, because there are people working in public health in the different organizations. There is also a certain number of people who are in the CIUS Centre-Sud. So this needs coordination. So we want to make some adjustments.
And second question for Dr. Arruda about deconfinement. We're seeing a deconfinement more and more in Montreal. What kind of surveillance is the public health department have in place to see if the deconfinement is leading to a further spread? I heard you on Mr. Arcan talking about the demonstration the other day in Montreal, and that. What kind of surveillance do you have in place monitoring the spread?
We are, first of all, looking at the way people are acting. We are seeing people with less distanciation. We are looking at the, I would say, and having also some sondage inquiries to try to understand how the people react to the deconfinement. Those data are made by our staff here at the Ministry of Health with some sondage companies. And we still have looking at the intensive, I would say, surveillance of the cases and contacts. So if somebody gets sick, is being tested. We are testing the contacts of that person. We are looking at different kinds of outbreaks that could happen locally. So we are getting the same data we did, very aggressive. The numbers are going down, so we get more time even to look at the data. But in fact, we are making sure that there is no emerging situation. As there was been some manifestations a week ago and another one this week, we're going to look at if there is any people who manifest to getting sick. Perhaps the question is going to be asked and making sure that what was the impact of this actually.
Thank you. So now the next question is from Raquel Fletcher, Global News. Mr. Legault, what message do you have to bereaved families of the now 5,000 victims?
The message I have is that I'm sorry. I'm sorry for the decisions that have been taken or not taken for the last 10, 20 years. Of course, we're sad for the families that are close to these people. 5,000 deaths, it's a lot. 4,500 were coming from those residences. So it's clearly, there was clearly some problems with residences, the number of employees, salary they were paid, at the beginning, precaution regarding infections. So I think we really need to change the situation and make sure that at least those what happened would be a lesson for Quebec.
Thank you. And as a second and very last question, the plan for the confinement seems very piecemeal, unlike other provinces that have clearly spelled out their different phases. So when bars, when churches, when gatherings of more than 10?
Okay, as I understand, the people who are left, seems to be left away, wants to know exactly. We are finishing, I would say, our planification, and especially not only the planification, it's also the tools that we want to make sure that we work with the SNES, with the industries or the different sectors are prepared to help people to do that. So, but I think in the next days we're going to announce the dates based on the experience we are having.
Est-ce que c'est possible pour vous de répéter en français, vu l'importance d'information?
Bonjour, les gens qui sont...
Yes, the people who have not yet been deconfined are asking us a question, when will they get a date? As we were saying, we're finishing the work, not only defining the days, but also to give the instruments and tools to each sector, things that are specific for their own environment. And this is something that is done with the CNESST and with public health and the partners from the different sectors. So over the next few days, we'll be able to announce a plan, particularly because it will also allow us to see how the deconfinement, that already took place, how it's going. If there are, outbreaks and we're losing control, you understand that we're not going to continue deconfinement. So over the next few days, we should be able to give you the plan. So with dates, yes, with the plan dates, which are all, dependent on the fact that the situation will be kept under control. Thank you very much. This puts an end to the press conference. Thank you, everyone.